this is amazing. These patients are actually now in control of something that before they had no control of.
You are tuned into the Dr. Tyna Show with Dr. Tyna Moore. For more, visit drtyna.com. On this episode of the Dr. Tyna Show, I have a very special guest joining us, Dr. William Seeds. If you have not heard of him and you are interested in peptides, you are in for a treat. Dr. Seeds is a board-certified orthopedic surgeon that's been practicing for well over 25 years. He is the founder of the Seeds Scientific Research and Performance Institute. He is the OG expert on peptides and cellular medicine. He's hosting the Peptide World Congress next month in June 2025 in Las Vegas. I am honored to be one of the speakers on the main stage, and I get to talk about all the things you need to be doing in order to get your peptides to work optimally. Dr. Seeds and I had a great conversation today. We kept it short so that you guys could take it all in. We talked about GLP-1s, of course. We talked about them in their utilization for their neurocognitive benefits. We talked about them in the use of weight loss and behavior change. And he brought up some really important points that you may not have heard before. And we talked about why strength training, which he and I both loved, is absolutely non-negotiable if you want to optimize your outcomes with this peptide or any others. So without further ado, let's jump in. Dr. Seeds, welcome to the Dr. Tyna Show. I'm so excited to have you here today. I don't know how else to put this. I've been fangirling you for a long time, and I just love all your information that you've put out in the world around peptides. You are the OG, in my opinion, and so I'm really honored to have you here on the show today.
Well, thank you, Tina. This is it's a pleasure to be with you. I'm humbled by what you said. Thank you. Hey, it goes both ways. I want to let people know we're very excited to have you come to the Peptide World Congress and be one of our main presenters. I'm very excited to get you on stage. I think you're a dynamic speaker. I think you do an excellent job communicating with your people, your patients, and I just like your approach. And so that's why I'm here. I don't do many of these. I do very few podcast interviews, but for people that I think are really representing what all of us are trying to do, and that's what improve outcomes. Really, looking for everything we can do for our patients. I mean, you exemplify that, and I'm excited to be part of this with you.
Thank you. Thank you. I am very excited to speak at your event, and I actually have some ideas rolling around my head. I'm going to run by you at a later date to make sure we nail that talk, because I'm excited for the messaging there. Okay, so we're going to hop in because I know that you're a busy man, and I wanted to share with you that I came around to GLP-1s and just sort of their magical benefits, if you will. I hate to use that word, but truly, when I first started digging into the literature around them, I was like, holy smokes, these have a multitude of impacts across the body that are really impressive. And I kept having people say, have you listened to Dr. William Seeds' work around this? And I knew of you, and I knew of you in the peptide world. I actually had purchased a few of your online courses, but I hadn't actually heard you talk on that subject. And it was JJ Virgin. I don't know if you are friends with her, but she's a huge fan of yours as well. And she was at a conference that you spoke at, and you were talking about the neuroregenerative impacts of GLP-1s. And so I had already been knee deep in the literature when I went back and found some of you do have very rare appearances on podcasts, but I found the ones I could, and really just astounding. I'm so blown away with what they do in the brain, and I hope that we could just start there and you could share your knowledge with us on that, because I think that they're one of the most promising things out there for neurocognitive health.
Yeah, so, you've touched on, GLP-1s are a very interesting peptide that, and I don't know if I'm allowed to say this, but I'm going to tell you that I have a book that's coming out here in the next month or two. There are about 20 books out there on GLP-1s. I think this will be the game changer in better understanding the pleiotropic effects, meaning the many different pathways that these GLP-1s work, and in particular, addressing some of the things you're asking me about right now, and how you have found them to be an integral part of your practice, and in where they play a role in many areas of cell efficiency and in improving aspects of metabolism, neurological function, and so forth. So I'm really excited to kind of get that out, and it's been a passion for, gosh, maybe well over 10 years. I've been teaching about GLP-1s, and the last 2 years I've really focused on finishing this book. So I'm sorry
exciting. I'm excited.
Sorry to take that soundbite away from you.
No, it's good. This is great.
But I think it just kind of, it leads into this question you're having here where, yeah, I think this is one of the most exciting areas of many of these aspects of what the GLP-1s, how they provide a role. And I think the basics, let me start at the 30,000 foot view maybe, and then maybe I can kind of go down to the devil in the detail as far as you want. But let's kind of look at this as a, GLP-1s, they're one of the aspects of GLP-1 is its role in not only improving aspects of glucose absorption, insulin sensitivity, slowing down the gut for better nutrient absorption, all of these things, but it works in the brain through specific pathways to keep it simple, to do some, to take a step in decreasing the, let's say number one, decreasing the patient's appetite. And why does that happen? It happens because we're allowed to provide the brain with a super physiologic at the beginning. Now this can go two ways. You can use this gets into another discussion, but you can use high doses over a period of time, or you can even go with low doses over a long period of time and potentially achieve the same things. But let's just say, these GLP-1s are something that you produce in the gut, in your L cell, that have the ability to communicate with the brain in a way to decrease your ability to want to eat. And so let's back up with that and understand that most of these people that get into issues with weight and metabolic insufficiency, they have a much more difficult time controlling their appetite and don't realize that they're providing their body with an over surplus of nutrients and food. And they may even develop certain addictions, right, to sugar, to chocolate, satiating type of foods that they don't realize that what they've developed a behavior to. And I think that's where this all comes into an interesting place here. We can, if we look at it as when people get into these states of a nutrient surplus and their eating habits change and they don't really see it, they don't realize it because it's become a behavior that they can't control. And in fact, it's actually signaled into the brain where these in specific in the hypothalamus and the POMC neurons. It's an area of where this signaling takes place to control basically appetite. And what happens is the behavior is set. And so what does that mean? It means not only as the cell signaling changed based on what we would call an mTOR state, where the cell is constantly activated and promoting this behavior, but it's also it's setting off other pathways of influencing dopamine expression and dopamine for gratification for what they've done, and that has to do with connections in the hypothalamus and so forth, and so they're in this pattern basically. And so what's really interesting is, and I started noticing through before GLP-1s became a weekly a once a week thing. We were using GLP-1s that we were dosing like twice a day. Then we got into the ones we were dosing every day. And that's kind of where we were in that phase of like using a lot of liraglutide. And we learned a lot years and years ago on these influences of where we could get people to this. So when you introduce this, this exogenous source of a GLP-1, and let's say we use some higher doses of it initially to influence that pathway in the brain to turn off the appetite. And basically, what are we doing? We're changing the state of that cell. We're taking that mTOR state and turning it off and creating an AMPK state. AMPK being catabolism, mTOR being anabolism, and so it's a switch that we're turning off that has allows other cell signaling processes to occur, and that has to do with the melanocortin receptor 4 and its influence on decreasing appetite. And so what happens is the GLP-1 process kind of turns off that appetite seeking behavior. And that allows, in combination with decreasing appetite, it allows also the metabolic aspects of what it does for efficiency, which we may get into or may not here, and what it does for the cell and improving fat oxidation, AMPK in the cell, the things that it does to improve efficiencies to utilize your own fat, improve the flexibility of the cell and the efficiency to start losing weight. Because what is losing weight? Losing weight's a side effect of cell efficiency.
Mm-hmm.
So that process begins, and you go through that time frame of getting that patient from whatever your desires are, 10, 20, 30, 40, 50, 60, 70 pounds, whatever it takes. You can get your patients over time, and I express this very passionately, it has to be over time. It can't be this fast process that so many people don't realize they're creating more problems with. But you take your time with this, many, many, many months, up to a year and a half, whatever it takes, depending on the patient. And once you kind of reach those states, you can start backing down on this GLP-1. And what happens? So what happens is you have patients, and I learned this from my patients. This was incredible, actually, and then I can correlate it with the research. I started seeing a certain subset of patients that were saying, "Hey, Dr. Seeds, I'm going down on my dosing, like you said, because there's so many other benefits, right, that these GLP-1s have with the immune system, with bone, with bone morphology and muscle activation and muscle growth and brain activity and you name it, kidney function. There's so many other things that the GLP-1s play a really significant role in. And so patients, we typically will go down to this using a very small but effective dose that we feel we're making those strides with. And when those patients start backing down, so we got some of our patients that were saying, "Hey, I had this desire to want to start eating. I thought, oh my gosh, here comes my appetite. How am I going to be able to handle this?" And what we were learning were that the patients were teaching themselves new behaviors. They were taking advantage and brilliant in their own accord. On their own accord, they were developing a new behavior, saying, "Well, gosh, I recognize now that I'm hungry. I recognize that I could go eat this, but I'm going to choose not to." And the more they did that, the more it became a behavior. And I was like, holy Christ, this is amazing. These patients are actually now in control of something that before they had no control of. And in fact, that went a step further because you had patients that were saying, "Well, gosh, if I can do this, maybe I can, jump into a new hobby, or maybe I can learn something new and retain it better." And And so I started seeing some of these incredible changes where people took on new activities, new learning behaviors, and they were very successful. So then I took that to the next level of where I started working with my patients in training them that they had this capability. And that was the hardest part, was to learn the art of giving your patients that knowledge that, hey, guess what? You have this new capability that if you decide to take advantage of it, it's not easy. It's like anything you do, right? You go out and you lift weights, you want to get stronger, you want to get more performance oriented. It takes time, it takes work. You learn a new language, it takes work. You learn an instrument, it takes work. It's not easy. Well, it's the same thing with learning a new behavior, especially when before that behavior became something automatically you couldn't control. Now it's the art of teaching that patient, hey, guess what? You have control of this, and this is how I suggest you work through it. And it's building that behavior. Oh my gosh. After that, after I learned that over a few years and working with our patients, it was like, it raised these GLP-1s to an incredibly new standard. And for what I felt people needed to know. And interestingly enough, years ago, I was at a research meeting in, it was in Singapore, where a specific lab had been working, the Max Planck lab, actually, out of Germany. They were working on actually nailing down these mechanisms of new learning and capability of changing behaviors. And they correlated the molecular pathways with this GLP-1 in healthy people, like taking healthy young students. And I'm talking to the endocrinologist who's the lead head on this abstract and presenting it. I'm losing my brains. They're listening to this. And I'm like, holy shit, I'm doing this in practice. And so we talked, and it was just an incredible experience. And I think on both sides to see that, hey, clinically people, I mean, I didn't have an influence on them. They were going to write the paper anyways, but it really drove. I think we added to each other's enthusiasm with where this was going to go, and they published their paper, and just being able to share that information just secured, moving forward. Where we have an area here that's untapped and incredible, especially if you take advantage of it, knowing that it's something your patients can harness. And I'm going to tell you something right now. And again, I'll stop because I can talk forever. The patients, it's not going to work with everybody. I mean, it's, behaviors can be recreated very quickly, and it's not an easy thing to do. And especially if you're not conveying it well to your patient and you don't work together on it. But I would say it's very significant in how it can occur. It's a game changer, and I hope that answered your question and what you were asking me.
Well, yeah, because I mean, it induces neuroplasticity, and so how I came to this was I had hit perimenopause, and I was feeling like my brain was not working the way that it used to. I used to have this brilliant ADHD that was like my mad genius skill, it was like a superpower, and it wasn't going so well for a hot minute, and stress had been very high. I pushed back really hard during COVID on a big platform and, dealt with that. So I was looking at GLP-1s predominantly because my background's in regenerative injection therapies and regenerative medicine. And I was looking at it from like the the decrease in neuroinflammation, the sort of like resetting of the microglial cells. And I was sitting there looking at this literature just in shock. And this was during the height of the Ozempic craze, when it was so much clickbait happening all over. It's still happening, but the internet was going insane. And I thought, what if people's L cells are just fried? Because the bulk, I mean, I test everyone's gut, right? And I treat everyone's gut. I'm a naturopathic doctor. Everybody's gut is pretty trashed. And I thought, what if their L cells are just fritzed out from all of the chronic inflammation, leaky gut, whatever? What if they have a functional deficiency? It's not just an overt, but a functional deficiency. They've gotten themselves there, if you will. And if I gave them just the tiniest little bit, and I was thinking in my head as like I told my husband, I said, I think of it like when he's an electrician, like when you go and you blow a fuse in the house and you have to reset the circuit. I feel like GLP-1s could be the circuit reset. And what if we used really tiny doses and we just gave them back what they needed? Kind of like when we functionally supply thyroid hormone, or we give, a woman even in her 30s or younger, a little bit of progesterone if she needs it. These functional, we just give them back a little bit. I'm not trying to hit them with pharmacologic doses of anything. And I started doing that, and it was profound. Like, it was just crazy. I was watching pain go down, most importantly, because that's my wheelhouse. But I was watching conditions like inflammatory bowel disease calm itself down, and then the subsequent chronic body-wide polyarthralgia, joint pain, go down. I had one patient who was neurodivergent and went on a GLP-1. She's quite normal. And I hate to use that word, but just for the sake of, the world around us, because I love my neurodivergent people, but she just had much more normalcy in the way that her brain was functioning. And she was able to keep her job steady and hold down the fort much better. And all of these, so I was tinkering with it. And then the exciting part about being able to give people with addiction a little bit of an edge to help change those behaviors, like you said. And I was able to do this all with really, really tiny doses. And none of it was ever for weight loss or type 2 diabetes. I mean, everybody could use some metabolic assistance, but that was the thing that got me most excited. And then just to see all this literature that's already been out and that's coming out, and hearing about some of the things I've heard you talk about in different venues, that to me, I think, is the most exciting part, because I think from a top down, I'm a chiropractor too, so everything's top down. If there's something going on neurologically, that controls everything else, right? Your cardiovascular system is going to be compromised. Your metabolic health is going to be compromised. Because if the listeners don't know this, if you get a big whomp on the head, you can go right into metabolic dysfunction from there, So I know it's like you said, it's pleiotropic. I know it works right down at the cellular level to do some really incredible things. But for me, I'm kind of thinking from this top-down neurologic perspective. I'm just spitballing here, but that to me is really the most exciting part about this. And I don't know of other peptides that do that. I'm sure you know the neuropeptides better, but man, it's pretty cool how we can just take even the smallest dose in many cases and wind things down. And like you said, it doesn't work on everyone, but it can just sort of wind down the noise of all the noise across the board, and then give them this window of opportunity, this neuroplastic window where they can relearn new behaviors and rewire them in. That's how I see it.
Yeah, and I think you're right on target. I mean, it's all relative to, most, we always learn things from, we've learned a tremendous amount about these metabolic and molecular pathways through normal cell function with good exercise, good diet, good sleep, and so forth. And then we learn the other extremes of the disease states and how these things occur. And then when you have that information, like you are, like you indicated here, you had people that pretend they weren't really in a state of where you felt they needed this for weight loss in particular, where actually, these GLP-1s they're originally were studied in the mechanisms of cell efficiency, right? In cell flexibility, of improving metabolism. And it always comes down to metabolism and cell redox of everything. And so with you're not wrong in looking at the top down, because if let's say people are compromised by not, so one thing that you should know too is that you also have the capability of producing a little bit of GLP-1 in the brain too. You can, it's not in the gut. But the predominant production of GLP-1s, absolutely, like any other cell signaling aspects, can be influenced by aging, disease states, and so forth. Environmental things, epigenetic influences, right? Higher allostatic loads, all of those things can have an influence. So you touched on something where you thought, well, maybe this may be something that I could improve by just improving the potential of getting back to the normal endogenous production of a GLP-1. So those GLP-1s in the brain, from looking at you mentioned in the brain, if you're working on cell efficiency, let's say the microglial cell, which is a cell that influences significant cytokine, chemokine, and proteases that are influencing astrocytes and neurons that create this inflammatory state. They phase change right into an inflammatory type of propagator in the brain. And if you're influencing the GLP-1 receptors, which, by the way, microglial cells have, astrocytes have, neurons have, if you're influencing that metabolism, in particular, influencing the mitochondria in making that redox state better, that then influences not just ATP and NAD production, but you're influencing the signaling of those cells, which is so important in influencing PGC1 alpha, the SERT gene activation, NFR2 production, all of these things that play a role in what? Controlling inflammation of the brain. And so absolutely you've got something that is, I think, critical. Again, not just in the brain, but in the kidney. I mean, here's just another thing to throw at you. Years and years ago, they said, oh, you can only use GLP-1s for stage 4 kidney disease, maybe stage 3. Got to be careful because this could work against the kidney and cause kidney failure. And those of us at that time said, well, that's complete bullshit, because if we're improving the aspects of cellular function in the parietal cells and in particular, the mesangial cells of the kidney and the podocytes. Well, wait a second. We should be improving glomerular filtration and kidney function. And in fact, what have we seen now? Oh my gosh, the literature now is, hey, how do you keep somebody from a kidney transplant that is in kidney failure? You put them on a GLP-1 and you're going to preserve that longer. So look at where this has come. And so I think it definitely, resonates with what you've said. It's like, hey, here you kind of hit upon one of those pathways of a peptide that plays a significant role, again, in redox control, cell efficiency, and flexibility. And you mentioned, are there other peptides specific that can do that? Absolutely, and they're different all around the body. But the GLP-1 is one of those really cool ones that has so many different areas it works in. And that's why it's always caught my attention, and why we've been so focused on trying to teach healthcare providers this information for over 10 years. And just all of a sudden now it's like everybody wants to know about it. I'm like, Jesus, where was everybody 10 years ago?
I think that's a whole other topic, but people are fatophobic. And the minute you start talking about weight loss, they don't understand. It's very odd. And you're right. I mean, going back to what you said, at the end of the day, this is about the metabolic health of the cell at the cellular level in the brain, which is leading to all of these wonderful impacts. So, people just don't want to go back that far into their thinking. And I think the community at large thinks it's just, if you just eat less and move more, all this will work itself out and the cells will all reset themselves into a beautiful state. And they don't get it.
Absolutely. And I think really where it's gotten even more fascinating is on the research side of where we knew GLP-1s were the beginning, but it was, what are the next steps in the evolution of these GLP-1s that can even improve that cell efficiency even further to mimic normal cascades of different pathways that need to be activated when GLP-1s are working efficiently. And that's where it's gotten really amazing, in introducing the terzepatides, and which are the dual agonists. And then I'll never forget when they introduced I think it was in the research. The first research was presented in Portugal on this retatrutide and adding glucagon. And at the time, when people said add glucagon, we're thinking, wait a second, glucagon? Are you kidding me? You're going to put glucagon in when we're trying to inhibit glucagon. But wait a second. Oh, wait. If you really think about these mechanisms, and you're like, oh my gosh, how could we forget, glucagon is this incredible hepatokine. It's meaning it does something in the liver that is so important in upregulating something called FGF, or FGF21, which is crucial to PPAR alpha, gamma, Krebs activation, all these things that work systemically to improve what? Fatty acid oxidation, ketone body production, insulin sensitivity, the thermogenic gene expressions that we haven't even discussed in beige adipose tissue. And I mean, even that aspect of suppression of those things we talked about in the CNS, right? In the metabolic behaviors. Glucagon plays a role by its activity with this upregulation of the FGF21 in the liver. So what I'm trying to say is it's only going to keep getting better as this research really gets to hone in on something that is so pivotal in changing metabolic function.
So that takes me to a question I have, which I've been rolling around in my head. And I'm just going to explain it as simply as I can for the listeners. If GLP-1s are upregulating the AMPK pathway, that's awesome. In the longevity space, for those listening, that's, get the mitochondria going. It's all the rage of the longevity space. This is what fasting does, intermittent fasting. This is all the things, right? We get AMPK going. Okay, great. And then we've got mTOR, which, if you look at it from the standard American diet and the regular, American person walking around, it's probably in more of a pathologic state. But when you look at it from the muscle protein synthesis standpoint, you need mTOR activation. This is what we get after we strength train, we eat our protein. And so in my head, just really simplistic kindergarten version, we need to balance AMPK with mTOR. It's not a matter of revving one side or suppressing the other, right? Like we need this in balance to be a happy, healthy human. We need both sides, doing the nice teeter-totter dance. And I think that folks who are taking the GLP-1 or anything that's going to potently rev AMPK, that side of things, if they're not doing this side, if they're not hitting the gym and eating enough nutrient-dense food, including protein, I think it puts them into long-term more of a catabolic state. I think it can. I think that's why we see some of these folks on GLP-1s who aren't doing it right, and they just look like melted candles. They look like they're melting and their soft tissues are melting off their bodies, and they're not doing anything but just eating the same foods they were eating prior to going on it. They're just eating less of it. So they're still eating the standard American diet, and they're not doing all the things. But if you hit the gym and you eat the protein and you do all the things, these are almost anabolic-like, and you get this beautiful synergy of both sides happening and the body really responding in turn in the most healthful way. we just can't have one side going for too long, too hard, and too fast. And that's my concern about the long-term use of GLP-1s in the average American who's not being managed well in a comprehensive way. And they're just sort of, hitting the pen, getting themselves up to the highest dose, and then hoping, now they're stalling. We have a whole group of people out there who are gaining the weight back and who are stuck at the highest dose of tirzepatide and nothing's going well. They're regaining the adipose tissue and they're just waiting for retatrutide, thinking that's going to solve the problem. But then I'm even more concerned because if you have glucagon agonism going and you're not hitting the gym, if you are hitting the gym, you're going to be put in more of an anabolic state. If you're not hitting the gym, you're going to be put in even more of a catabolic state. Am I over the target here or am I way off? Or am I making sense?
Well, you're making sense and you're trying to think your way through it, and it's awesome. I commend you on your thought process, and you're in the right places. But I think what you have to look again as it's not one way or the other. It's if we're working on improving efficiency of the cell, we are then enabling it's a modulator. It's not and it works on demand.
Okay.
GLP-1s, they work on, it's why you don't get into hypoglycemic problems with glucose with GLP-1s. GLP-1s work more, it's a more precise type of peptide that works on demand, and it works as a modulator. And so think of it this way, if I'm working on improving the efficiencies of the cell, meaning its ability to do what? Switch from AMPK into mTOR, mTOR back into AMPK. It has to have that flexibility, right? It's got it. And it loses that flexibility when it loses that metabolic advantage to use like fat oxidation when it needs it, or protein catabolism, which is something that occurs to make up sometimes. This is where you get into issues with people not knowing how to utilize these appropriately as the healthcare providers, where they push things too fast. They don't realize that the cell is getting efficient, and it may, in order to provide more glucose or to do things for enhancing what's already happening with fat oxidation, it may want to catabolize like glutamine from the muscle, to utilize protein, because that's kind of what's happening. It's getting another source of glucose. And so this is why it becomes so important to understand, and you're right, in at least initially with the initial GLP-1s, we realized a while back that you had to have, because you were stimulating, changing metabolism in not just improving fat oxidation and so forth, but actually you were causing some calorie restriction because of appetite suppression. That was like a double whammy, right? You're improving metabolism from the metabolic aspects of changing truly fat oxidation, which just improves ATP and NADH production and efficiencies of how the cell uses glucose, fatty acids, and proteins. But you're double whamming it with this appetite suppression that's further calorie restricting the body. So you've got some extra influences that you got to account for, and you got to make up for that. And so you're right in thinking initially with the GLP-1 and mTOR, well, gosh, protein, we know in particular leucine, has an influence on inducing protein synthesis, and then exercise itself, in particular resistance training, as another factor to increasing the production of or the mTOR state activation. And what are we trying to do? Retain muscle so it's not being catabolized, and also to potentially even improve muscle protein synthesis, which you can do absolutely just with GLP-1s by themselves, if you understand that. So So it's an understanding of the mechanisms, and then also understanding that you can take advantage of those mechanisms with providing the proper stimulus. So that's where kind of exercise, strength training, protein synthesis kind of made a real difference in providing a much better environment for your patients to benefit from training, especially if they were, especially if you're using low doses, and these aren't people that are achieving weight loss. But the weight loss definitely is a different place in understanding that. And we learned all that a long time ago with calorie restriction and what that really emphasizes, because everybody loses muscle with calorie restriction.
Right.
What happens with the GLP-1s is just people are using such super physiologic doses without really compensating and trying to do it too quickly and just not understanding the mechanisms there. Now, let's take that a step forward of what you were also jumping into, saying, well, glucagon may not be a good thing. Well, actually, as we get better with these GIPs and glucagon additions, we're actually getting into a state of where we're doing a better job of muscle preservation and enhancing lean mass production, because that FGF secretion that I was talking about, well, that's fat oxidation. It's sparing. You think of it as fat oxidation sparing muscle. Like the muscle is, it's got a source that it doesn't need to catabolize muscle, if that makes sense. And then the addition of the GIP, it's even further anabolic support. You think of it as you're lowering the effects of cortisol and the FOXO transcription genes that reduce, that have a role in muscle catabolism. You're reducing muscle catabolism signaling of cortisol and of the FOXO transcription with that addition of the glucagon and the GIP. So you're making mitochondrial health better. You're balancing also that process of the appetite control with the severe calorie restriction. So there's a lot to it, and that's why it's so exciting to see where these GLP-1s have gone. In particular, from what you and I are very interested in the training aspects. And this is a huge step with this glucagon addition.
I think it's really exciting. Everyone I've heard that's actually been using it loves it, but they're all generally relatively fit people already, and they're just optimizing their overall body composition with it. I haven't talked to a lot of people who've used it predominantly for more excessive weight loss. And I haven't used it for that. My only concern at the end of the day, and it's not the same standard, oh, you're going to lose muscle argument. It's just the actual, because what I've noticed with some patients and with some clients and with some people I've consulted with is that even at the tiny, tiny doses, I'm talking like 1/5 of the standard starting dose, tiny doses, if they don't actively get their protein macros hit and they don't actively strength train, they do start to waste. They lose their ass, they lose their strength in the gym, and they just start to, and it seems to be a little bit more robust than if they weren't on the GLP-1, because there is that low key appetite control happening and maybe even appetite suppression, even at those tiny doses. So who knows? Maybe they're under eating, maybe they're under lifting. Hard to say. My only concern is, are we inadvertently revving pathways too hard, too fast without compensating for the balance?
That comes down to the heterogeneity of the population. It's like everybody needs to understand that it's why you tailor these things. It's why you have to be in communication with your patients. You hit it. There's some people that are going to be very sensitive, and some people that GLP-1 receptor activity isn't as sensitive. And that's why, as you keep moving up the ladder, you're just ensuring, like, are you doing a better job? Like, if you ask me, are you doing a better job with a low dosing of retatrutide versus semaglutide? Absolutely, because you're doing more to enhance mitochondrial efficiency of muscle, the glucocorticoid signaling, the proteolysis aspects,
Yeah.
you're reducing the muscle proteolysis by downregulating, the atrophy genes of these muscles. So you got to utilize that knowledge to take care of those type of patients that you're going to see those specific changes in, because you see it with everything. It's why aspirin doesn't work the same way for everybody.
Yes.
It's why these peptides work differently for everybody. It's everything has to be tailored. And the more, I think, and I love the way you're thinking, I think the more you try to understand how these work, what the process is in their function within the cell, then you've got a very clear understanding of how the sensitivities can change and how some people can be, very sensitive, and how you have to adjust to it, right?
Right. Yeah, you got to meet the patient where they're at. You have to assess their short-term and long-term goals, and then you have to go on the journey with them and tailor it along the way and keep it tight, because things change from day to day, and all of these peptides, like you said, it just depends on their receptor sensitivity. A little bit too much can be a lot too much for somebody. And some people need whomping higher doses than others. And it's really, there's just not a standard. I wish there were an algorithm that you could follow, but there just isn't, in my opinion. I think that you've got to just really stay in touch with your patient.
Well, and that's the problem that, Tyna, you hit it on the head. And I think this is why you're an amazing practitioner for your patients, is that you realize that everybody's different. And that's the problem. Everybody, right? They want a protocol.
Yeah.
Well, it doesn't work in this world. If you're on this front of really taking care of people, the first thing, that you're going to tell everybody is, well, everybody's not the same. I mean,
right. The internet doesn't like that, Dr. Seeds. They want the answer. There's got to be some standard answer for every human walking, apparently.
Yeah, it's very frustrating, because it's, it's just frustrating because people don't. It's harder, I think, for you and I, who are on the front line. Let's say that, hey, we're doing this every day, and we went into this thinking, oh my gosh, got this down. Like I can tell you, a long time ago, I thought, my gosh, I've got this so well dialed in. I'm going to just do this, 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 and this. This is the way the pathways are going to work, and we're going to do amazing things. Oh my gosh, was I humbled or what? It changes every day, right?
Isn't it funny? The longer I'm in this world, the more I realize I don't know anything. I think that's the sure sign, right? You're just like, what am I? From day to day, from month to month, year to year, it's ever changing. But the cool thing is if you are a good practitioner and you stay tight with your patients, then you can, and patients are compliant. That's the other huge part, right? They got to go to the frickin' gym. They got to go to the gym. If you're going to take a GLP-1, you have to move your body. Preferably strength training. That I will die on that hill. It's the beautiful synergy. It's like when people are crushing their protein macros, but they're not going to the gym. I'm like, what are you doing? You're missing the whole synthesis.
Correct. Okay. And my gosh, we must have been brother and sister from the same. The pillars of, okay, we do all these things with peptides and small molecules, repurposed drugs, and prebiotics, postbiotics, probiotics. Okay, that's all great. But what are the real pillars of life? It's nutrition, it's sleep, but it's exercise, and it's strength training. And I don't know how, the most fascinating thing that just drives me continually is knowing that we're learning, that the muscle is like the biggest endocrine gland we have. It produces over 500 to 700 of these exerkines, myokines. We've only defined 70 or 80 of them. We don't even know this other 450, and there's probably more that have such a relevance on health and well-being. And I hate that frickin' word longevity. It's health span. It's health span.
Yeah.
It's health. It's right. It's what do we care about? I care about tomorrow. I want tomorrow to be my best day, but I want today to be my best day too, right?
Yeah.
It's not 10 years down the road. It's not if I'm not doing what I'm doing now, 10 years from now, then somebody better shoot me because I need it. And how have I gotten there? Yeah, I've done all these other things that enhance my strength training. And I can't say enough about that. And we know it's hard, right? It's hard work, Tina. It's not easy. There are days that you got to just walk in the gym and just say, okay, I showed up, and maybe something will happen. And it's not easy, right? But boy, does it pay off. I mean,
being chronically depressed and in chronic pain, which was like half my life, that is a lot harder than just getting my ass into the gym. Because who cares what I do while I'm in there? I just think of it like a big playground. Who cares what I do when I get in there? I mean, I may just dink around, but I always leave feeling better. I always got a little sweat going and I feel better. So win. That's a win, right? That's it. You got to get your juices flowing at the end of the day, and you got to get stronger because you're right. Longevity. I think of longevity and I think of like the whole vegan fasting crew and just a bunch of skinny old people that look weak. I don't want to be that version. I just want to be strong and healthy and vital with a good libido and a good set of legs to get me where I need to go. And then hopefully, at whatever time that candle flickers out, it flickers out, but I don't want to go into it a frail little thing. That's really the ultimate goal. It's just not the frail little thing.
But all the research proves that you're correct. I mean, there's so much data and literature that provides the framework for all of this, for people to understand there is no magic pill. The pill is working out, right? And all these other things that we can provide can make that a better environment. And that's why these GLP-1s and strength training are just, they should be inseparable. I mean, it has to be part of the conversation at some point that you have with your patients for them to realize they're missing out on something if they're not partaking in that, right?
Absolutely. Absolutely. Well, this is what I'm going to be talking about on your stage at the Peptide World Congress. So when that's in June, I'm very excited. Do you want to tell the audience about that? I know we're coming up on time here. I don't want to keep you too long. So I want to make sure people know where to find you, and for all the practitioners listening, where to find more resources from you.
Oh my gosh, this is where I fail miserably.
I'll do it for you.
My team will give you all that info, I guess, or you'll have it. And then you can, they just kind of say, okay, doc, you need to go here. You got to have this ready. It's like,
I'll do it for you. It's the ssrpinstitute.org /PWC. That'll get you to the Peptide World Congress. You guys still have tickets for sale, I think. So that'll be super fun. And this is a cutting edge research, patient outcome based conference. From what I understand, I did the online version last year. It was amazing. I tried to come in person, but I got invited to Diary of a CEO in London. So I had to go to that instead. So I did the online version, and it's all peptides, cellular medicine. I think it's a really great starting point for all. I have a lot of practitioners who listen to the show, and they are always asking me, where can I go learn more? And I started with you guys. So that's what I'm going to tell them to do. SSRP. Institute.org. There you go.
I very much appreciate it. I think people will be surprised what they see. I think they'll be energized. I think it'll ignite your passion that's already there. I'm excited to I really love providing an environment for, people like yourselves that I want to get you out there for more people to know about you and what you're doing. And because you're doing it right and you're doing it well. And that is where the energy and the momentum continues to push this whole SSRP forward, because medicine in just health is changing. And there's so many influences out there that are not necessarily giving the right information, right? And here we're trying to provide a platform for real research-based, evidence-based aspects of the cell, and in particular peptides and small molecules and so forth. But not neglecting exercise, not neglecting sleep, not neglecting the microbiome. All of these things are in this place at the SSRP, and so I think people will be excited with what they see and the people they meet, and it's going to be a big conference. it's extraordinary. I'm extraordinarily humbled every year how this thing keeps growing and exploding. And this year, it's at war. It's exponentially grown because we're going to run out of space, and that's unheard of. At the Wynn Hotel.
Yeah.
That doesn't happen, and we're about to reach that goal.
I'm excited. It's going to be a good one. And I'm just excited. Last year, why I wanted to come, honestly, was because I just wanted to find my people. Because I get lonely. I get lonely in this world. And I have a lot of friends that are great functional medicine practitioners, but they don't live and breathe the gym life. They don't get it. They don't do it, for the most part. And so I'm just excited to be in a room of people who get it, all in all.
Well, Tyna, you'll be happy to know that if you ever talk to any of my kids, and you may meet a few of them out there, growing up, our family conferences are discussions. I mean, people spent time in the living room. Well, we were always out in the gym. That's where every major decision was made. It's where I think the kids kind of got their drive and passion for really regimented processes, that I think made a difference in their life. And in fact, it plays a role. If you came and saw where I work, like my main office, my office is my gym, actually.
I love it.
And I actually work out in these clothes in between, working on a presentation or research or whatever I'm doing. It's all incorporated. That's my life. And my staff, everybody knows that. My teams know that. My kids know it. But it makes it fun. It makes it.
I love it. I love it. Well, I don't make any major decisions until I deadlift. And that's my rule. I'm not allowed to. I have to deadlift and I have to sleep on it. And then I get to make a decision. So that's how I keep otherwise I make rash decisions. Well, Dr. Seeds, this has been such an honor. I loved having you here. I hope you'll come back someday. I'm excited to be on your stage next month. I promise to bring my A game, and I will make sure to get everybody the links in the show notes so that they know where to find you.
Well, thank you, Tyna, and we're excited to have you. And I look forward to opening your eyes to. I think you'll be even surprised. Oh my gosh, what have I gotten myself into? And it's going to be exciting.
I love it. All right. I'll see you there.
All right, Tyna, thanks for having me.
Thanks for listening to the Dr. Tyna Show. This is a Wellness Loud production produced by Drake Peterson and mixed by Mike Fry. Theme song is by John the Guilt. You can watch the full video version of this podcast inside the Spotify app or on YouTube. As always, you can email the podcast at podcast@drtyna.com. That's DRTYNA. And if you like this episode, please rate, review, and subscribe on your favorite podcast app. You can also find all of my offerings on my website at drtyna.com. For more shows by my team, go to wellnessloud.com. See you next time, and thanks for listening. This podcast is for general informational purposes only. It does not constitute the practices of medicine, nursing, or other professional healthcare services, including the giving of medical advice. I am a doctor, but I am not your doctor. No doctor-patient relationship is formed. The use of this information and the materials linked to this podcast is at the user's own risk. The content on this podcast is intended not to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.